for those who have what we call a family history, it may only be a pointer to the fact that you may have a genetic abnormality that predisposes you to get breast cancer. So there are breast cancer genes, for example. So if, say, a mother or a sister had breast cancer, especially if they had it at a young age, that may only be a pointer that you have that gene. But only up to about 10% of breast cancers have that gene. In other words, 90% of people who get breast cancer will not have any history at all of anybody in the family having breast cancer. So not having somebody in the family who has had breast cancer doesn't mean you can't get it. It only excludes about 10% of breast cancers. But the majority of people who get breast cancer don't have that history at all. We advise that every woman should examine their own breast once a month. Now, for those who still have their periods, we advise that you wait for about a week after the periods when the breasts are not too tender, and then do this examination, standing in front of a mirror, having a look at the breasts just to be sure that there's nothing abnormal, and feeling or touching the breasts using the palm of the fingers and pressing the breast against the chest. So there's what we call breast self-examination. So every woman should do this once a month. For those who have finished having their periods, just choose a day that you can remember in the month and do that. So that's only one part of it. But main advantage of breast self-examination is to create an awareness of your breast, is to know your own breast, so that if there's a change, you can identify it. So that's one. The second one, we advise you once every 3 years to see a doctor to be examined, or a nurse who knows how to do breast examination. After the age of 40, we advise that is done once every year, to see a doctor to be examined. But probably the most important is what we call a mammogram. A mammogram is an x-ray of the breast, but this is for people who are a bit older. So people who are 40 years and above, once a year or once every 2 years, should go and have an x-ray of their breasts. And the biggest advantage, or the main advantage here, is that you can actually detect a cancer before you can even feel it. Okay, so you can detect that there's cancer in this breast when the examination will not show anything. And so if you can detect it at that stage, then cure is almost assured.